I have a 13-year-old female who came into the program around November of 2023. When we first got this new patient, she came in for anxiety amongst a lot of excessive worry, irritability. She had a lot of palate issues, which in turn was affecting like her BMI, having some excessive weight loss. And with the palate issues, it made it difficult for her to eat certain foods. And so we had a host of things just trying to figure out where to start. One of the biggest things in dealing with anxiety was a lot of social issues with school. And it was to the point with this young person that she would often isolate in the house. She wouldn't come out of her room. There was very minimal engagement with family. And then when it came to school, she was one of those students that would sit in the back, not engage with the class, very minimal interaction. And so we began by introducing exposure therapy among addressing things like her sleep, with her diet. We did a referral to a dietitian who later referred her to occupational therapy. So she is now currently receiving occupational therapy to address the palate concerns, the sensory issues, addressing different supports for how she eats and different foods to hopefully address the weight concerns. But in regards to the anxiety piece, we began to implement exposure therapy, and we started off very small due to, in the beginning, every session was just full of tears, full of pushback and worry and self-doubt that she just could not do it. I can't do it. And so we began by making some small goals and letting her lead. And what I found was that the more we began to retrain her brain, and she experienced the positive repercussions, if you will, from the exposure therapy, the more she began to see that, hey, I did try to go up and introduce myself to one person a day. And they said hello, and I'm okay. It was uncomfortable at first, but I got through it. The more she began to experience that, it kind of reduced and countered the negative initial fear that something bad's going to happen. So we're at this point now, several months in, where the patient did start out with like a PHQ-9 of 12, GAD was a 16, and the SCARED was a 63. And so that was back in November. And current scores now, the patient has, I want to say the patient SCARED now is down to a 48. And so there's a lot of growth as far as with her initiation now of leading group projects. She is in art clubs where she is in agreement with letting her art be on display, and she's receiving these awards. And I think again, it has trained her now to trust the process. Though it makes me a little nervous, I'm going to try it. And by continuing to practice different activities that she struggled with, it is constantly retraining her brain to trust that she will be okay. And so here we are. Almost hopefully nearing the process for her. She's now taking medication, able to take it effectively. We've implemented a liquid form for her. And again, she's making friends easier. And then she's even engaging with family to where now she's, going up, and where she normally would avoid hugs or avoid compliments, she's more receptive and opening to it. So again, I think this is just the beginning. It's one of those things that she'll have to continue to practice, just to continue to be comfortable with. But just to see her from November till now, she's totally turned things around to where she's able to go outside and play and engage. She's able to go to birthday parties, and then participate in some things she loves. So again, she's making a lot of progress. Because again, this is a kid that hopes no one sees her. She often felt like, if they forget me, I'd rather them forget me than that way I won't get any attention. And she went on vacation. When she came back, the class was telling her how much they missed her. Did she have a good time? And she downplayed it. And she's like, oh, they were just saying that to be nice. But it really opened her up to say, wow, they do know me. They did realize I was in the class, and they actually miss my presence. I definitely will say with this particular patient, it has been definitely a team effort. And I can't say enough whether it went from the PCP to now she has a therapist. So her therapist, our team psychiatrist, as well as the occupational therapist, when it came to sharing information, was very helpful across the board. So, once the patient was able to see the occupational therapist and her giving her recommendations, I was able to take them. And when I met the patient in session, review kind of some of those goals as well. So it was definitely a process of connectedness and communicating across the board. My experience, their experience, when there needed to be med changes, quickly signing off, and there was no breaks in care or service to the patient. So overall, I think it just worked like a well-oiled machine, honestly, just with the communication and kind of addressing all of the needs.